I got this
Right.
text at 6:01, Dr. Goree. I'm not going to tell you from who. 6:01 from someone prominent in our community who said, "I hope Dr. Goree comes on your show this morning to talk about the decision to keep Caddo students masked. I've received many emails from furious parents." That was 6 o'clock this morning, an early text. I know you've gotten a lot of comments. You've decided to keep the mask mandate in place in Caddo schools. Tell us why.
Right. And first off, I'll say I've received a diversity. I've received a lot of very upset parents, but I've also received a lot of very happy parents and staff as well. When we look at the way this school system has managed this pandemic from the beginning, we have been very consistent in this very divisive topic that we will trust the science and we will truly look to our medical experts as our guide to how we manage this process in schools. I think as we looked at our medical experts, those are our local medical experts, as we looked at the Louisiana Department of Health, as we looked at the Centers for Disease Control, among a few, clearly there is still support of mask mandates in K-12 settings. Now, let me be clear. Everyone wants to see the mask mandates lifted, and we are aggressively working toward that, and we'll continue conversations even today around how and when do we get there safely with the support of our medical experts. And
Now,
that's been consistent
didn't the
from the
governor
beginning.
Didn't the governor listen to medical experts? Didn't they advise him that it's okay to do this?
But very clearly, the governor said that K-12 he was not lifting the mandate within the K-12 setting. However, he offered an option based on improved numbers. And I don't disagree with that, and I'm not to debate that. But when we had our conversations with our local medical experts, our advice was to keep the mandate in place. Let's look at important things like giving our 5 to 11-year-olds an opportunity to begin vaccines, which should come very soon. But even more importantly, we're working closely to see how can we begin the process of even for our quarantine guidelines to be less restrictive. Because there are some questions and some concerns that even I push back on the doctors about. And we have questions. We have questions into the LDH team today from Caddo Parish as it relates to how can we support families and students with some of these quarantine guidelines.
Dr. Goree, this is Scott Hughes. You mentioned in the middle there about getting to those 5 to 12-year-olds with the vaccine, and that seems to be a big part of the governor's plan. What is Caddo looking at and or other districts in terms of actually getting the kids vaccinated? Will that be a parental responsibility, or will Caddo bring that to the schools the best they can?
So pretty much dominated every conversation I've had the last week with my team, Scott, in the respect that we're looking at, okay, do we look at how can we utilize our sites to support that? And that's a little problematic when you think to 5 to 11-year-olds. So we're looking at how can we either utilize our sites if we're doing that just as we did with the high schoolers, the middle and high schoolers, if you'll remember in the spring where we had those vaccine opportunities on our campuses, we're looking at either that as an option or we're looking at even maybe opening our sites up on Saturdays. But several conversations with Dr. Bancheri and his team who have been amazing around how we can get those vaccine opportunities out as quick as possible. But I think the thing that everyone needs to understand that we too are working toward lifting the mask mandate as soon as we can with the advice of our medical teams.
And then I also know, as you know, I have another daughter in the Caddo system, and my wife's in the Caddo system, and both of them are participating in a program where Caddo offers them a testing regimen every week, and they can get determined if they are negative or positive. Is that program, is it currently in place for the younger kids, or will it be expanded to the younger kids?
So that program is in place for younger kids, and again, that's something that our health department is able to gather that information. And I do think those are some of the numbers that the governor was able to brag about yesterday, and we're so proud. First, we're proud to be in-person learning, but then we're also proud that we have seen those appropriate declines when you look at those positivity rates as it relates to adults and students, even though the student rate would be a little higher than it would be for the adults.
Okay, I know you have your big boy britches on. Here's a couple of texts. I'm getting messages on our Shreveport Security Systems message board. The science says masking is detrimental to kids. Another text. Children are not super spreaders. Why are we continuing this? I know you want to address those. Those are issues you're hearing as well, right?
Right. And again, everything you're hearing, I'm hearing, Aaron. So, I had my big boy pants on for 2 years now for sure. But what I will tell you is that when I question those to our medical experts, and those are our local experts, these are not all people that are in Washington or Baton Rouge. But when we put those questions out there, the answers to those questions simply do not support us lifting the mask mandate just immediately. But again, we're all aggressively working to that end.
Vaccines. Have you thought about, for those that are vaccinated, you don't have to wear a mask? Has that been on the table?
All of those things are on the table, and those are things that we will continue to work through as we go through what is the safest way, the way to create the safest environment. However, there are some management issues when you look at that around how do we know who is vaccinated, how do we know who is not, because, again, our ultimate goal is to create the safest environment, and that's in support with those, not with what I think as a parent, because I too am a parent, but not what I think as a parent, but more importantly what the medical community is speaking to as the safest education environment for children in person.
Dr. Goree, we're talking mainly in terms of in classroom right now. How does the new policy affect extracurricular or like football games? I know Thursday night's a huge football game in the community, the Bird Shreve game. How does the new masking policy make any changes to other activities, not just showing up on the bus at school?
So one thing I'll tell you is that it does not affect those things because those events are outside. So those events the mask requirement originally did not cover them. So we will continue to not require any masking there. I think, too, I want to note that my team is working also towards, I know we've had a lot of concerns and emails around parents on campus. We're relaxing some of those guidelines so that you will see more opportunities for parents to start returning to campus. And these are things that we've worked hard. We've done pilot opportunities, and these are things that we do believe we can do in a safe environment. So I do think those are some of the relief that parents are going to see happen immediately. But I do think even if we go back to April, May, as vaccines started rolling out and as things started changing, Caddo Schools was very responsive, and we did start having field days and things like that to engage parents and to try and return to a sense of normality, and that will continue to be our goal.
And so the governor changed the statewide policy, didn't change the K-12. Is there any issue at the school board level? I know a lot of the people that are contacting us or calling us may want to come to the school board, have their say. Is there any action the school board has to take, or is this a policy already in place by the school board, in place by you, the superintendent, or is it going to take a school board vote?
So at term, this does not take a school board vote because the school board has viewed this as a day-to-day operational decision. So under my leadership and, of course, with the support of my team, we have made these decisions. However, as you know, anything can always go to a school board vote. But, again, this is something that our school board has chosen to support the decisions of the administration with.
Dr. Goree, don't think I'm a smart aleck here. In our last 30 seconds or so, you're following the science. You're listening to the same health experts in our region that Bossier is. Or is Bossier not listening to them?
I'm in no position to answer that question. I applaud Mitch and his team. Mitch is a dear friend of mine, but I'm in no position to answer that question. But I do think, I will say this, I do think if you look at this, it's hard to compare districts because districts are different. I think if you look at EBR, who is doing exactly what we're doing, they're different. I just think that I think communities are different. And I think if you look at how this is played out in large urban communities with much more diversity of thought, you do see a little bit more of a caution with removing mask mandates.